Hi everybody, this is Dr. Sham. I'm a rheumatologist practicing in Chennai. So now we shall be seeing about gout. See, there is something called uric acid. It's a salt which is present in the body. It has its normal functions like maintaining blood pressure. For some reasons like genetic and other things, our kidney may not be able to push out the uric acid. So these patients, uric acid tends to increase in the blood levels. Over a period of time, it's like adding too much of sugar in water. After some time, you will see the sugar getting deposited in the bottom. It won't be able to dissolve in the water. Similarly, after certain point of time, the uric acid won't be able to dissolve in the blood. It starts getting deposited in the joints and other places like kidney. So one such event, once it gets deposited in the joint, the end result is something we have an inflammatory arthritis called as gout. Suddenly, at the middle of the night or sometimes post procedure like a surgery or patient getting admitted in ICU, patient will wake up with a severe painful joint. Usually it will be in the great toe. Usually it will be in the ball of the great toe. Sometimes it can be seen in the ankle or the instep also. So this is a very typical ball of the great toe. Suddenly it will be really excruciating pain. Even if your bed sheet or any towel touches also, you'll have pain. Or even if the fan, that air blowing from the fan also can cause pain. Such severe will be the pain. Many times patient rush to the hospital immediately. It's not something serious, but the pain will be so excruciating that we won't forget. Many times, once you take a painkiller, the pain goes off, or sometimes even without treatment, also it might go off. So usually it starts like this. The patient might have once or twice in a year. Then, if you are not taking care of it, the frequency increases and it start ascending. For example, initially it will be in the ball of great toe, then ankle, then it goes to the knee. If it is really bad, then it will start affecting the hands also. So gout is something which comes due to a high uric acid, and usually it starts with episodic arthritis, comes and goes, comes and goes. Remember, you have to take care of your uric acid. If it comes once or twice, then it's okay. But in case if it is going to keep continuing, then definitely your uric acid level seems to be high. That has to be taken care of. The other important thing, it's not only about the joints. The uric acid can get deposited in the kidney also. They can form calculi like a kidney stone. So uric acid stones also is possible. So that is another thing we have to think of. So just remember, somebody with a high uric acid with the clinical pattern typical of gout. This is another thing which can happen. Sometimes even a patient with rheumatoid arthritis can have a high uric acid. So it's not that always high uric acid plus joint pain is equal to gout. The pattern should fit into a gout. So that will be able to be, your physician or your rheumatologist should be able to do that. So just discuss with them and make sure it's gout. Many times these days with a lot of mastile checkup and other things, we do see patients with high uric acid. They might have an osteoarthritis or a non-specific pain and they think it's gout. Not so. And regarding whether should we treat only high uric acid, maybe in the next video, maybe I shall touch upon that. So as of today, this video, the take home message is high uric acid, severe episodic arthritis, particularly starting in the foot. Think of gout, and it's not just going to be your joints. In future, it might even touch your kidneys also. And people with gout, there is a high chance they can have an associated risk of coronary artery disease. Many of these patients have associated disease like what we call part of metabolic syndrome, like diabetes, having cholesterol, having high blood pressure. So all these things can go along with gout also. So this is about gout. Thank you.